Hi, I'm Dr. Sarah Janz. I'm here today to talk about IUDs. IUDs are fast becoming a popular form of birth control for many women, and it can be difficult to decide if it's the right birth control for you. What is an IUD? An IUD is an intrauterine device. It's a medical device that's placed during an office visit from a vaginal approach and provides effective long-term contraception. There are several different types of IUDs. Those that contain the hormone progestin, including Liletta, Mirena, Kylena, or Skyla, and the copper IUD, which is called Paragard. The IUDs differ in their length of use from 3 to 12 years, depending on which product you ultimately choose to go with. A common question I get asked is, how do the IUDs work? They work in a way where they change the environment inside the uterus so that the sperm can't swim to reach the egg. Without the sperm reaching the egg, there's not a conception. An IUD insertion is going to be done in the office with a healthcare provider. It's not that much different than a pelvic exam in the fact that we will use a speculum to be able to visualize the cervix. We will clean the cervix to make certain that we don't introduce any bacteria from the vagina into the sterile uterine cavity. We use a device to measure the length of your uterus so that we can set the IUD inserter to your specifications, and then go ahead and insert the IUD. You can expect some cramping during the procedure. Typically, this would be resolved with ibuprofen and some rest. The IUD is an effective form of birth control. Less than 1 in 100 women will conceive with an IUD in place. What makes it so advantageous is that it's placed for you. You can't forget it. You can't use it incorrectly. It provides 24-hour coverage. An IUD is a reversible form of birth control, which allows you to determine when you want to try for pregnancy. You had the IUD removed and your fertility returns right back to normal. Common question I get is whether or not it's a factor of if women are virginal or if they've never been pregnant before on their decision for an IUD for birth control. Neither one of these are factors as I help women navigate which form of contraception is best for them and does not make them ineligible for an IUD. There are some considerations when you're choosing an IUD for birth control. It does not provide any coverage for STD prevention and should be used with condoms if there is concern of a new partner or the potential of exposure to sexually transmitted infections. There can be complications with the IUD insertion, and that includes things like misplacement or perforation. Luckily, that's a very rare instance. Typically what we do is we teach people to feel for their IUD strings and have them watch for signs and symptoms of misalignment. If you're having ongoing bleeding or pelvic pain, that would be a reason to follow up with your healthcare provider. Another important consideration is the risk for ectopic pregnancy. This is a pregnancy that's not located inside the uterus and can be life-threatening. Again, if there would be signs or symptoms of pregnancy after an IUD is placed, that would be a reason to follow up with your healthcare provider immediately. There are other health considerations when choosing an IUD. If you've recently been treated for a sexually transmitted infection, unusual shape to the uterus, or if you have a condition like Wilson's disease, an IUD might not be the right consideration for you. I hope you found this information useful. As always, it's Moreland OB-GYN's goal to lead women into better health.